Hey guys, today we are going to see about history taking. First, we are going to see what is meant by history taking. So, basically, history taking means collecting the patient's complaints in their eye and writing down it. In history taking, demographic data, presentacular history, pastacular history, general history, family history, social history, and birth history. These topics are comes under history taking. Let's see these individual topics in detail. A good history taking helps us to focus on what examination are needed and also leads to a proper diagnosis. So first we are going to see about demographic data. Name, age, gender, address and occupation of the patients. These all are comes under demographic data. Name is used to identify the patient. Age is used to find age-related disorder. In children, it is used to find congenital disease, and in case of old people, it is used to find senile disease. Gender is used to find gender related disease. Occupation is used to find occupation related disease. For example, if some people using computer for more time means they may suffer from computer vision syndrome. And then those laborers who are working in industries may suffer from chemical burn in their eye. Next, we are going to see about presentacular history. Presentacular history means writing the complaints of the patients presently having in their eye. In case if the patient says they come to the hospital for power checkup or general checkup means we can write it as power checkup or else a general checkup. In case of patient's language, we need to communicate with the patients what comfortable language patients wants to speak. Let's see about chief complaints. First, defective vision. Defective vision means blurred vision. Next, watering and discharge means mucus or pus that is coming from the eye is known as discharge. And next is redness. Next, asthenopia. Asthenopia means eye strain. Photophobia means extreme sensitivity to light is known as photophobia. Next, burning sensation. Next, itching. Foreign body sensation means feeling of grittiness or having something in the eye frequently caused by a foreign body is known as foreign body sensation. And the next complaints are pain, headache, deviation of eye means the eyes are directed in different directions. Diplopia means double vision. Halos means bright circles of light that surround headlights and other light sources. Colored halos means that circles appears in different colors. Distorted vision means objects looks like as wavy or in a bent position. And the next complaint is eye irritation. Pricking sensation means sensation in the eye like something pricking with a needle. And the next complaint is cloudy vision. Twitching. Next one is floaters. Floaters mean spots in the vision that look like black or grey specks that drift across the eyes. And the next complaint is matting of eyelids. The next is sudden loss of vision. And the next is fleshy growth and the dryness. Let's see how to write presentacular history. First, we need to ask what is the complaint, and we need to ask in which eye you have the complaint, and also we should ask the complaint is mild, moderate or severe, and finally we need to ask how long you have the complaint. As we already know, OD means oculus dexter, that means our right eye, and OS means oculus sinister, that means our left eye. OU means oculus reticule, that means both eyes. Let's see some of the examples. If the patient complaint is severe watering in the right eye for 3 days means we need to write it as OD severe watering into 3 days. And the second example is if the patient complaint is mild redness in the left eye for 2 days means we need to write it as OS mild redness into 2 days. And the third example is if the patient complains they have pain in their both eyes also associated with a headache for 1 week means we need to write it as OU pain with a headache into 1 week. Next we are going to see about pastacular history. We should ask the patient if similar ocular related problem have existed before. And also we need to mention the previous eye surgery or eye injury of the patient. And also we need to ask the use of any ocular medication if he or she is presently using. Let's see how to write the past ocular history. If the patient says 10 years back they have done zyoptics in both their eyes means we need to write it as OU zyoptics done into 10 years back. Let's see another example. If the patient says 1 year back they have done cataract surgery in right eye means we need to write it as OD IOL done into 1 year back. Next, spectacle history is most important. Ask the patient is he or she using any spectacle. If using the spectacle means ask the patient since how many days or months or years he or she using the spectacle. Like the spectacle history, we need to mention the contact lens history also. We need to ask the patient is he or she using any contact lenses. If using the contact lenses means we need to ask the patient how long you are using the contact lenses and also we need to mention it. Next, systemic history. We should ask the patient about any systemic health related history is existing or not. For example, diabetes, hypertension, thyroid, kidney problem, asthma, heart diseases and malignant diseases. Next, drug allergy. We should ask the patient about you have any allergy to the drugs and also we need to mention it. Let's see about family history. Family history helps to identify the hereditary diseases. Ask the patient whether the family members having the diseases like glaucoma, squint, myopia or cataract. Next, birth history. Birth history is taken for children only. The history should be processed as if baby birth is premature or forceps delivery or low birth weight. Ask the patient if the baby having fits jaundice from their birth. And also we need to ask any history of ICU or incubator of the baby. At last, social history. We should ask the patient if the patient is consuming smoking, alcohol, or they have any occupation or home circumstances problems. I hope you guys understand the topic history taking very well. If you like the content means like the video, and for regular optometry updates subscribe our channel Optom A to visit.